Hello, everyone. I hope you're doing well today. Today, we're going to be discussing the Beckman Coulter heart failure study. This is an RC study, which means that RAs are not allowed to consent patients for this particular studies, and only the RCs can. However, RAs are still responsible for screening for any eligible patients and notifying the RCs of these potential patients, as well as assisting the RCs in the overall enrollment process. So first, let's cover some of the basics of the study. So the principal investigator for the study is Dr. Mills, and the purpose of the study is to determine the levels of natriuretic peptides in the blood when patients have heart failures, and then this information will then be used to develop new blood tests in the future to help physicians diagnose heart failure and determine the severity of heart failure. Before diving more into the study, let's talk about heart disease broadly, as well as discuss what these natriuretic peptides are and how they relate to heart failure. Heart disease is the leading cause of death in the U.S., with over 650,000 Americans dying from heart disease each year. And the most common complication of heart disease is heart failure. Heart failure is when the heart can't pump enough blood to support the other organs in the body. Therefore, when heart failure occurs, there's a lack of oxygen delivery to those various areas. There are several risk factors of heart failure, and they could be divided into two categories. One is medical conditions, and the others is unhealthy behaviors. Some medical conditions that can cause heart failure are coronary artery disease, diabetes, high blood pressure, and obesity. In addition, unhealthy behaviors such as smoking, excessive alcohol intake, not getting enough physical exercise can also increase the likelihood of heart failure. Here are some common symptoms of heart failure. There's shortness of breath, or the medical term for it is dyspnea. It's also having trouble breathing down or breathing when lying down, which is called orthopnea. Other common symptoms include fatigue and weakness, as well as swelling or edema in the legs, ankles, and feet. So next, we're going to talk more about natriuretic peptides and how they relate to heart failure. So what are these natriuretic peptides? They're peptide hormones that are synthesized by the heart, brain, and other organs. And the release of these peptides by the heart is stimulated by atrial and ventricular distension, which is any swelling or increase in internal pressure. And the function of these peptides is to reduce pressure by decreasing volume and systemic vascular resistance. Now, NPs can decrease volume by directly acting on the kidneys. When they act on the kidneys, that will increase sodium and water excretion, thereby decreasing overall blood volume. They can also directly act on veins and arteries and dilate them, which will decrease overall pressure within the system. Now, since natriuretic peptides, or NPs, are released when there's increased pressure or swelling, low levels of NPs are particularly useful to exclude heart failure. For example, let's say a patient comes in with dyspnea or shortness of breath. To determine whether that's either due to heart failure or other issues such as pulmonary issues, a physician could test for the levels of NPs, and if the test comes back as showing low levels of natriuretic peptides, then that would exclude heart failure as the cause of the shortness of breath. So going back to the purpose of the study, by collecting and better understanding that relationship between natriuretic peptides and heart failure, we can use that information to develop new and more effective blood tests that can help physicians diagnose heart failures and determine its severity. And better understanding the relationship between NP levels and severity of heart failures can also help guide different therapeutic avenues. So let's go back and talk more about the study, especially the inclusion and exclusion criteria. So here are the inclusion criteria for this particular study. And for the study, all of these inclusion criteria must be met for the patient to potentially qualify for the study. And the first inclusion criteria is an age inclusion. All individuals who are going to be enrolled in the study have to be greater than 21. The second one states that subjects have to present with clinical suspicion of heart failure. And the third one is we have to have access to their clinical history. Let's take a closer look at those last two inclusion criteria. The first one is subjects have to present with clinical suspicion of heart failure. What that means is that these individuals have to have symptoms of heart failures. That includes shortness of breath or dyspnea, orthopnea, as well as swelling in the legs, feet, or ankles. And those symptoms have to be related to heart failures, which we would confirm by talking with the physician. The last inclusion criteria is we would have to have access to their clinical history. That essentially means that we have access to their chart or electronic medical record. And in the ED, we can't have access to some charts, such as individuals who are 5150 or prisoners. Since we can't enter those charts, those individuals cannot be enrolled into our study. So let's take a look at the exclusion criteria next. Here are the exclusion criteria for the heart failure study. If any one of the things in this list holds true for a particular patient, then they do not qualify to take part in the study. And the first one is that dyspnea or shortness of breath is clearly not secondary to heart failure. And an example would be that if an individual presents with shortness of breath, however, there's no indication or suspicion of heart failure, and instead the shortness of breath could be from a lung disease. In that case, they would not qualify for the study. The second exclusion criteria is stage 4 or 5 of chronic kidney disease. And for us, what that means is if their GFR is less than or equal to 29, then they would be excluded from the study. And GFR is glomerular filtration rate, and it indicates how well the kidneys are working. A GFR of 60 or higher is in the normal range, and any lower than 15 may mean kidney failure, while in between may mean kidney disease. And the third exclusion criteria are subjects are on chronic dialysis. And the next exclusion criteria is that they are participating in another clinical study which might interfere with the participation in this study. And the next exclusion criteria is if there's anything that would place the subject at increased risk or preclude the subject's full compliance with the completion of the study, then they would also be excluded. And the last exclusion criteria is if they are non-English speaking. Let us now discuss our role as RRAs for the study. Our primary role is to screen for patients and report to the RC when we identify a patient who potentially qualifies for the study. So how do we identify patients on EMR? We can take a look back at the inclusion criteria. The first thing that we're looking for is the age inclusion. We are keeping an eye out for any individuals who are greater than 21 years of age, greater than or equal to 21 years of age. Another inclusion is that there needs to be a clinical suspicion of heart failures. So some chief complaints to look out for are dyspnea, shortness of breath, as well as if their chief complaint is heart failure or CHF, which is chronic heart failure, or another one is orthopnea. We can also look at labs or any imaging that has been ordered, which could indicate a suspicion of heart failure. So some labs to be on the lookout for include BNP or N-terminal proBNP, and both measure the concentration of natriuretic peptides and help diagnose heart failure. So if we notice that these tests have been ordered and they have resulted abnormal, we can look for further information into the individual's chart and ask the physicians if there's any suspicion of heart failure. Another test to look out for and see if it's resulted abnormal is the complete blood count or CBC, which can be used to check for anemia, which can also cause similar symptoms to chronic heart failure as well as contribute to chronic heart failure. Other than lab tests, we can also check to see if there's certain imaging that was ordered. Example include electrocardiogram, which is a test that looks at the heart's electrical activity and rhythm. We can also keep an eye out for chest x-rays that are ordered, especially if the chief complaint of the patient is related to the symptoms of heart failure. In that case, the chest x-ray can tell whether the heart is enlarged or if those symptoms are due to problems in the lung, which could exclude the patient. Another responsibility that we have as RAs is to help fill out the case report form, which is filled out when the patient is being enrolled into the study. And this is the case report form. On the left side of the screen is page 1, and on the right side is page 2 of the document. And going from top to down, on page 1, we would fill out subject ID, date, time the consent took place, how the blood to test NP levels was drawn from the individual. And what follows after is a checklist. And these include just double checking that we've done all the necessary things, such as providing the patient with the necessary documents and that we've obtained informed consent before proceeding with the study. And below that checklist are 2 scales. The first one is the NYHA scale, and this is filled out by the physician who's in charge of the patient. And this scale places patients in one of 4 categories based on how much they are limited during physical activity due to heart failure. And on the next page, we also would have to ask the attending where the patient falls on the pedal edema assessment scale. And edema refers to any visible swelling caused by a buildup of fluid within tissues. And for both of these scales, we can assist the RCs in talking with the physician to see where the patient would fall. And that concludes the presentation on the Beckman Coulter heart failure study. I hope that was helpful to you all, and thank you so much for watching.